Today, we're going to discuss the Summary of Healthcare Policy and Concerns. This is by Mandy Gallagher for Chamberlain University, 2020. Healthcare policy influences every person through the regulations of who, what, when, where patients' care is being provided, as well as cost efficiency. The advanced practice nurse should have the ability to understand health policy goals and outcomes. Each practitioner should encourage a healthier, safer, more positive healthcare institution. This PowerPoint presentation will provide an overview of healthcare policy within a nursing profession. An explanation will be provided of how healthcare policy can impact the nursing profession and why advocacy is considered a vital element of the role in the advanced practice nurse. The impact of healthcare policy on health population will be discussed. It will include the selected healthcare policy concern, proposed solution, and relate the impact of the concern with the community and population group. This presentation will describe and suggest solutions to the healthcare concern, identify the slides provided for the elected official. The meeting details will be discussed with the elected official's response. A self-reflection will identify the new insights that were gained of the selected healthcare policy and its significance to the profession. Possible revision will be identified, and a professional organization will be selected that will support the proposed change in the future. Finally, a summary of the main components regarding the healthcare concern and elected official will be provided. For one to understand the healthcare policies and the impact they have on the profession, one must have an equal understanding of what policy is. The word policy describes as a meaningful course of action in response to a concern in order to obtain a solution. A high-level overall plan embracing the general goals and accepting procedures, especially of the government body, according to Merriam-Webster. Healthcare policies are addressing a specific concern that affects the community or healthcare in some form. They are created, formed, utilized for concerns of nurses who wish to provide better care in their communities and are then taken to the government to create new laws. According to Mason, healthcare policy affects every nurse's daily practice. It guides the course of action to improve the concern or issue. They begin with the problem, concern, issue at hand. They address the problem, who is affected, and how it can be fixed. The policy is then written using input and evidence-based research regarding healthcare issues to take to the Government Council for approval. They give a vision of the future that helps establish short and medium-term goals. The impact of healthcare policy varies greatly throughout many communities depending on the population health. In order to implement the necessary policies in various demographics, it is vital to understand the population health because it has an impact due to social cultural aspects of the disease type of the citizen within the United States. The population health reflects how ethnicity, race, and documentation status presents changes and challenges for some groups who are trying to navigate the healthcare system. It is important to understand how the population lives and what the effects on the policies that are implemented within their community will have in order to provide quality care. Nurses have the ability to encourage change of the healthcare policies through advocacy. Advocacy is an action that supports, promotes patients' rights, and enhances community policies, initiates the focus on availability, quality of care, according to Potter O'Grady. The role of nursing advocacy plays an influential part in the nursing profession, often upholding, uniting, and transforming healthcare policies. Nurses have an ethical and moral obligation to take part in healthcare policies and be an advocate for the patients and the community. Healthcare professionals identify advocacy as a process to guide policymakers to influence a change towards the institution of a solution. Healthcare provider-based interventions have been known to overcome vaccination non-compliance. Therefore, it is important for nurse practitioners to be a part of that solution through education and counseling on the importance of vaccinations. The family nurse practitioner reassures excellence of care by influence practice standards throughout guided principles and being the voice for the patient, family, and community. Vaccination immunizations have been proven to be one of the most effective health strategies to control and prevent disease. For example, measles have reemerged in the United States in 2015. A measles epidemic infected 102 people and spread throughout 14 states. Evidence shown that most of the population affected were not immunized, such as children, medical exemptions, immunocompromised. They were against the preventable disease that was almost eradicated in the United States. Outbreaks such as these have occurred yearly because of the unimmunized population and have some experts and politicians debating over childhood immunization's negotiability. This disease was once eradicated, indicating the effectiveness of the preventative immunizations. Immunizations are one of the most cost-effective preventative services available. They are reported to have saved 33,000 lives, prevent 14 million cases of communicable diseases, and reduce direct health care costs by $9.9 billion. Unless a disease is eradicated around the world, it will reappear, sicken, and kill anywhere, and each outbreak should be controlled. Children and immunocompromised individuals are those ones at a risk when others are not compliant with the immunizations. Immunity protects those who are medically unable to be immunized, but in 94% of the population to be vaccinated in order to have it. Immunizations provide immunity to the individual and all those who he or she may come in contact with. When a parent does not vaccinate their children, they are merely a vulnerable member of the herd who is not immune, leaving the vulnerable population at risk for disease and possibly even death. Elementary school entrance without vaccinations for communicable diseases prevention is the healthcare policy concern. Immunizations are one of the Center for Disease Control and Prevention's greatest accomplishments in the 20th century. However, many children are being allowed to enter the public school system without being immunized or vaccinated because of certain exemptions, such as medical, religion. Pennsylvania state vaccination requirements of 2017 states that the proposed resolution of the healthcare policy concern would make it mandatory for all students to comply with immunizations vaccination recommendations. The only allowed exemption would be a medical exemption from a physician assistant, or nurse practitioner. State Representative Tommy Sankey is a member of the Pennsylvania House of Representatives serving all of Clearfield County. PA State Representative Tommy Sankey was chosen because he speaks with his community regarding suggestions, problems, and concerns for the district represents. He generally cares for his community that he represents and serves. Representative Sankey is the sort of person who would advocate for health care policies and would be helpful in assisting with education his constituents of PA, state senator through education and presenting the health care policies. Pennsylvania State Representative Tommy Sankey was contacted to discuss the topic in a face-to-face meeting after the public health crisis is over. However, a briefing was completed over the phone about the topic. An appointment is still to be scheduled for a face-to-face visit, and at this time I requested a 30-minute time slot to be permitted. This will allow for me to show more detailed presentations, and at this time of the presentation, I intend to complete the introduction, qualifications, backgrounds, and healthcare policy concern. I will then request feedback and thoughts and concerns. A handout will be provided with the concerns, statistics, and proposed solution to the Immunize Pennsylvania. At the meeting, I will present a quick PowerPoint presentation with additional facts and information supporting the proposed change. I then intend to go into more details of the importance of vaccinations. With our current global situation, I feel that the governor will have a different outlook on the content of this meeting. After the presentation is completed, questions will be allowed to be answered, and they will be answered to the best of my ability. Representative Sankey was remarkably generous during our phone conversation and emphasized the need for legislation to make immunizations mandatory for school-aged children in Pennsylvania. Representative Sankey was polite and liked and supported the idea that was presented to him. He proceeded to offer his thoughts and plans to help support the health care policy concern because he agrees that there is a need to find alternative means to protect the population health due to the statistics that were presented to him over the phone with the number of unimmunized children attending the public school systems. There is a clear need for a stronger solution that will prevent outbreaks of communicable diseases in the future. But this problem did not begin overnight, nor will it be resolved overnight. This being my first elected official interview was very informative, and it was a great experience. Representative Sankey was very polite, knowledgeable, approachable. Talking with him on the phone was no different than talking to a personal friend or a neighbor in terms of understanding and validations of my concerns. The process advocating for change is forever challenging. The nurse is taken out of the work environment and placed in the political environment for which is not comfortable or the normal circumstances. A lot of planning is involved in this process and requires early preparation. Policy change was initially thought to occur just by showing the need, which is wrong. Finding the right elected official to present the idea to took a lot of time and understanding of the locality. There is a strong need for change because of the Department of Health showed that in 4,450 schools in Pennsylvania, there were 6,546 unimmunized children with religious or physiological exemptions. And 7,807 children were unimmunized for a medical exemption in 2015. A policy is not easy to change, fix, or even initiate. Even though there is a great need, change can take years to occur. There are many ways to effect change, but finding the right one is the issue and is critical for this success. As a family nurse practitioner, there will be an obligation to provide most accurate and up-to-date information to my patients. This policy proposal will greatly impact nursing with respect to giving in-depth, accurate information. Nurses play an important role with the education of their patients and should be involved in making of information regarding the immunizations. It is important for the nursing profession to advocate and maintain current knowledge about current risk versus benefits concerning immunizations. The positive impact nurses have on health outcomes will be seen through improved community health and communicable diseases. Representative Tommy Sankey was found to be passionate regarding students' healthcare policies and concerns pertaining to the future of our communities and cities within the state of Pennsylvania. I believe that there is a great opportunity to work alongside Representative Sankey for advocacy for the immunized Pennsylvania. Representative Sankey is very focused and knowledgeable regarding this healthcare concern and deem it vital to find a solution for this crisis. I was instructed to stay in contact with him, and he indicated for a possible speaking arrangement in the future to share my healthcare concerns and policy solution. Finally, opportunities were discussed, and it was suggested that a collaboration be formed to possibly develop a website or a flyer to assist in bringing awareness of the importance of immunizations, vaccinations, and the need for the solution to save lives, and not only in our community, but to all communities within the state. I am confident that there will be countless opportunities for open doors in the future as I continue to work as an advanced practice nurse and helping with healthcare policy. Family nurse practitioners have the ability to affect change in healthcare because they look for the solutions from evidence-based proven care. One revision that should be made to the policy is to offer information pamphlets and immunization clinics at schools for free of charge because they are mandatory. Offering the education and free health care should increase the number of immunized students attending the public school system because many may not have insurance that cover it and or afford it. The American Nurse Association attempts to represent nurses on Capitol Hill by providing support for the state associations to advocate agencies such as childhood immunizations. The ANA assessed federal agencies and elected officials in proposing and enforcing new laws that will progress the nursing profession, such as being a patient advocate in the prevention of communicable diseases and immunizations. Healthcare policies arise from healthcare issues that affect various communities both locally and globally, and most are initiated by healthcare professionals. Nurses serve the community by advocacy, education, and support. Nurses are good resources for communities in need of policy changes that can involve by serving on a planning board or being part of various organizations. Entrance without immunizations to communicable diseases is dangerous for our population health, for which is unacceptable. The proposed solution to make it mandatory to have all students comply with immunization recommendations with only exemption of being recommended for medical exemptions from a physician, with the support of a PA State Representative Tom Sankey, who really cares, this policy would help ensure public safety because there would be less occurrences of communicable diseases. Please review all the references as follows.